welcome to the Oral Health Podcast. Karen and I have got a special guest in today from PortmanDentex. It is Catherine Tannahill. You've heard from her many times on our podcasts previously and across our different radio days. She gets very involved with Mouth Cancer Action Month, as does everyone at PortmanDentex, which is fantastic. But we're here because it is World HPV Day. So yeah, we're here to talk about HPV vaccination rates because they are not where they should be. And actually, HPV is creeping up to be one of the biggest causes of mouth cancer. And so we'll get into all of that. But first off, Catherine, for anyone that doesn't know you, do you want to just quickly introduce yourself?
Yeah, sure. Hi, Sophie and Karen. I'm a practicing dentist and also Director of Clinician Engagement at PortmanDentex. So I'm responsible for maintaining a happy and motivated clinical workforce across over 340 practices.
So just light work then. You've obviously got loads of time to sit and talk to me.
Absolutely. But I'm very passionate about making people more aware about mouth cancer and looking at anything that we can do to support the Oral Health Foundation in their work, because it's obviously such a vital part of looking after people's well-being in the dental arena particularly.
It really is. Do you want to just talk us through some of the statistics that are coming out? So we know that vaccine rates are going down. They're not where they should be, but and the thing we say is that they're not hitting targets. Well, what are the targets that we should be hitting?
They are going down, and it is worrying because I think, there's been a decline in uptake, particularly in boys for some reason. We don't really know why. We're seeing normally it's girls and boys in year 8 and 9 and 10 that are vaccinated, and there was an increase last year in the last academic year, slightly over the COVID year, but then it seems to have gone back down again. And we're not really sure why. It is now a single dose, which is good because, it's just that one vaccination. So you would like to hope that the parents would be ensuring that we're getting all the children vaccinated. It's critical. It's concerning because HPV is responsible for 5% of all cancers, not just mouth cancer.
Yeah.
And it's responsible for more than a quarter of all mouth cancers, and that seems to be increasing.
So what are the signs and symptoms of mouth cancer while we're talking about HPV?
Yeah, well, mouth cancer can appear in any part of the mouth, so it might be the roof of the mouth, it might be the gums, inside the cheeks, the back of the throat, tonsils, under the tongue, very commonly under the tongue and the floor of the mouth, the sides of the tongue. So any area, and an HPV contributing can quite often be kind of the back of the tongue or the back of the mouth, the throat, the tonsil area, most commonly. Signs and symptoms, and also that's taking a long time to heal, kind of more than 2 or 3 weeks to heal. Quite often a painless ulcer initially, sometimes could be a red or a white patch, a lump or a bump, a change in texture, a change in sensation. It might be a loose tooth that's unexpectedly loose for no reason, or perhaps a socket where you've had a tooth removed that isn't healing properly. And also things like a sore throat or a hoarse voice. They're the main signs and symptoms.
And obviously being a dentist and looking in people's mouths every day, that's a topic that hits quite close to home, I guess, isn't it?
Yeah, sure. I remember, I've been graduated 30 years now, and when I graduated, we were told in the final year to expect to see 1 case of mouth cancer in our working career. I've seen probably a couple of handfuls now, so that gives you an idea of how much cases are increasing. And they've definitely doubled over the last generation. That's a known fact.
Yeah.
And I've seen firsthand the devastating effect of mouth cancer on people, how it affects their everyday, day-to-day well-being, and worse.
Yeah, I can see Karen nodding as well when you were talking about you were expected to see a certain amount of cases. So I'm guessing it was the same for you, Karen. Yeah.
Absolutely, yes. I mean, we were told in practice you'll only ever see one case, and when you get to have seen 3 or 4, you think actually that was wrong what they told us. And I mean, I haven't been actually in practice for probably about 25 years. So, that was creeping up then, but we didn't really know why. And when it started rising in younger people, we all kind of looked at each other and scratched our heads slightly again, because we were told men over 40 that smoked, drank, or smoked and drank, that
Hmm.
those are the people you're looking for. You're not going to find anybody slightly different. And then we were finding people with smokeless tobacco, younger women with that kind of thing as
Yeah.
well, because it's a sort of social event. So, as it was getting younger and younger, we were looking, well, they're not smokers, they're not drinkers, they're not men over 40. So what else is happening here? So obviously going through the time, obviously I'm not talking like a scientist because I'm not a scientist, but they've obviously all done, the research has been done, and it was found to be the link between HPV, especially type 16 and 18, was responsible for oral cancers as well as the other cancers that we
Hmm.
famously know them for. And to be honest, if you asked people, I think people generally would still say HPV, oh, that causes cervical cancer, and they wouldn't know
Yeah,
about any of the rest.
that's what
So
one
it
of the
is
things I
really
was going to ask
education.
because
Yeah.
it's yeah because I was like the first cohort that was given the HPV jab, and at the time it was just called the cancer jab. Or you got the cancer jab. All the girls get the cancer jab, and you got three. I had to get three, and then it went down to two, and then now it's down to one. So actually, there's loads that's being done to make sure people have it and get the right protection, but still, it's not the numbers aren't where they are, which is really.
Especially something so simple, one vaccination, you've got the captive audience of the kids being at school.
Hmm.
um I mean, my son was too old to have it at school. I really, really wish that they'd have offered it to him. um I do lecture him about his social activities, much to his disgust, but they need to know these things. And the more we talk about it, the less scary it is to talk about, the more people will accept us talking about these things. And we'll get the message across, because at the end of the day, it's about saving lives and restoring lives, because it's not just about saving your life, it's making your life livable and your quality of life, and keeping that as much as possible.
I
Hmm.
think you're right. I think because historically it's very much been linked to female cancers, probably the boys don't think that they need to have it. It's not applicable to them. And I think there is that taboo as well, Karen. You were saying about your son. I'm the same. My two boys just missed out having the vaccination, and I feel regretful about that. That having those conversations about sexual activity, and of course that's how HPV is transmitted, it's uncomfortable, and we need to demystify it and make it more comfortable to talk about, so that people will realize that this is normal, and it's just another vaccination in the list of childhood vaccinations, and it is important because it is going to save lives and make lives more livable.
Yeah.
It's also important to remember. I know I have a totally different conversation with my daughter, and Sophie and I have been and done some filming with her and her university friends, and we got onto HPV as we generally do. And they're a much easier, even just sort of 4 or 5 years later, they're a different generation to speak to. They are much more aware of the what the HPV vaccine does. Don't say to the stage of knowing about oral cancers. However, there are people still of my daughter's age group that haven't been vaccinated for some reason. Either their parents didn't want them to be vaccinated. The boys still were too old to have it. However, there was certainly at least one girl in that cohort that hadn't had it done, and she spoke to my daughter afterwards and said, my parents didn't want me to have it done, for whatever reason that was. And it's important to remember that you can back vaccinate. So up until the age of, I think it's 24 or 25, girls can still go to their GP and have the vaccination. So don't worry, you haven't missed the boat if you haven't had it by the time you're sort of 24, 25. You can still get it. So it's now obviously your choice rather than your parents signing the form. So if you want to have it done and you didn't at the time, please go and speak to your GP about it. It's really quick and easy.
And not only is it quick and easy, it's also effective. I think the
Indeed.
statistics are something like 97% effectiveness. So,
Yeah.
and very few reported side effects or ill effects. So it's nice and safe and simple and
Yeah.
easy to do.
And as well, I suppose compared to other kind of vaccines that you might have to have, like a flu jab or a COVID jab or something similar, you don't have to have it regularly. Once you have it, you've had it. And I guess unless there's probably a very specific circumstance where you might have to get another dose, but a dose beyond the treatment that you originally get. But I imagine for most people, that's not really the case.
No, it's not. I mean, it tends to be if you are a bit older, and that applies to men that have sex with men. You can have it at any age. You can get it at any age. However, you may have to have more doses. So again, speak to your GP, and they'll be happy to arrange a nurse to do that for you.
It's good as well because I'm looking through obviously the data. It's like 70% of people that are getting the first dose, and then that drops when you get to the second dose. So I am personally quite hopeful that now that it has gone to a single dose and we start getting the data around single doses, that we won't have that worrying drop, and also maybe more people will be more inclined to get it. It's less of a commitment to just get one jab, but
It's only this year that it's moved to that single dose, isn't it? This school year.
Yeah.
So let's keep fingers crossed that this school year we see an increase, and maybe a further increase as people get the idea that it is only that one single dose, one off, done, that's it.
I think there needs to be some sort of campaign or education in schools so that children know that, you know, by the time they get it, they are in secondary education, they are more in control of their own thoughts and bodies and etc. So, you know, it is something to have a conversation with your parents about if you are a young person coming up to year 8, 9 or even 10, about it. So, you know, some sort of school campaign would be great, just to show the effects of not having it and perhaps getting mouth cancer or one of the other cancers that HPV can cause, versus the small little scratch on your arm, which you only have once, and you are protected to, you know, almost 100% protected, and that is phenomenal when we look at vaccinations. I mean, that's really high when we talk about anything medical or dental. It's brilliant.
It is brilliant. And you think that I think the statistics are something around 4 in 5 adults will pick up HPV at some point in their lives. You know, that's massive. Okay, not everybody has any, you know, symptoms from that. It might be gentler warts, it might not be a cancer, or it might not show itself at all, but 4 in 5 will contract it at some point in their lives. So if everyone were vaccinated, ultimately, we should eliminate HPV from the population, as we've seen with other vaccinations. So, you know, to me, the more we can do against it, this nasty little prevalent virus, the better.
When we do sort of educational things, I love how we draw it. We draw it as a nasty looking, you know, thing that's going to get us. But, you know, it's it would be great if we could eradicate it completely, or, you know, get it down to levels that we barely see it. And we could be back to, you know, that a dentist only sees one case that is caused by HPV in the whole of their career. You know, we're getting the smoking down. We're looking at being smoke free by 2030.
Yeah.
So things are moving ahead that way. So if we can get the other way, then we're kind of taking everybody's risk factors down.
And you know, HPV obviously rising very quickly in the causes of cancer, but I think the statistics say that once it hits a certain year, we'll start seeing actually the cases go back down, because we'll have these people that are then older and in the typical patient age bracket for mouth cancer, and they'll be protected, so they're not actually contracting it. So then that has a knock-on effect. It's important with vaccines to remember that it's a long process. It's not an instant. You're not going to, oh, well, we've gave all the 10-year-olds vaccines, obviously the cases are going to go down now. Like, it doesn't
It's
work
going to
like
be
that.
30 years or more before we
Yeah.
really know and see the effects of that for sure. So I think in the meantime, we are going to see cases continue to go up as those ones like our son's generations, Karen, approach that age and of typical age for mouth cancer. Yeah, sadly, I think we will see cases continue to rise for quite some time before a successful vaccine program will show.
Yeah.
I did read somewhere that one of the growing areas, or the people that are, you know, getting HPV caused oral cancers, are women who are on second relationships. So they've been married for 20 odd years and they're now starting to date again almost, and, you know, starting from scratch. And there was an increase in that sort of age group, that sort of cohort, getting oral cancer caused by HPV virus, because, you know, you're actually having sexual contact with somebody new after a long time of being with the same person. So that was kind of an interesting area to look at. So maybe we'll see some uppings of that, because that obviously those women weren't vaccinated. They were, you know, like us, a bit too old for it, unfortunately.
And Karen, I think we've talked about this before, but I understand that you can pay privately to have the vaccine if you wanted to later in life, because although you pass that 25-year-old threshold, you could opt to, although it's pretty expensive, I understand.
Yeah, I mean, obviously now it's only one dose. Yes, it is cheaper, but, you know, as you're older, you may need two doses. So I've seen it anything from 250 to 350 per vaccine. So it could be costly, but, you know, even if you only had one, you're getting some protection, I suppose. Whether a doctor would be happy to give you just one if he felt that it was, you know, more effective to give you more. It's as I say, it's a conversation, and now whether it would be something that you would have to perhaps go, maybe a result from your smear test or something. Maybe you've got HPV or you've had it in the past, and maybe the vaccination. I don't know enough about vaccinations to say if you've had it in the past, whether you are protected in the future, or whether you would need a vaccine to kind of give that boost.
That's a really good point.
That's maybe something we need to find out about. Is there a test to see if you've had HPV? Do you need one before you have a vaccine if you're having it later in life?
Yeah. I mean, obviously, getting the young people in the country, getting them vaccinated is really, really important. But, you know, maybe when we've cracked that one, maybe we go to a different sort of sector. And we've added boys now. Now maybe we do add other people as more research is done as to where there is a growth in this type of mouth cancer.
Yeah, definitely. But we do need to focus on those younger age groups and catching them in that kind of 12 to 13 age bracket as much as we can.
Definitely. As I say, we have a captive audience now. We don't have lockdown or anything like that. So, you know, during lockdown, it's very difficult because we had 12 months where the kids weren't at school. So that year didn't get done. So I'm hoping that they were added to the next year, and they just did double the amount of vaccine because the kids were still young enough to have it done. So, you know, anybody that did miss it for whatever circumstances, as again, I can't say too strongly, go and see your GP, get it done. You know, you're entitled to it free of charge if you're a girl under 24, I think it is, and a boy born after 2009.
Yeah, and if you think you've been missed in any of those age groups, go and speak to your GP and get sorted for sure.
One thing I think would be quite interesting, or at least interesting to me, who has an interest in these things. But what if you're past those age ranges and it's out of pocket to pay for a private dose, which it might be for many people, it's quite, you know, £250 is a lot of money. What can you do to protect yourself against HPV in day-to-day life?
It is sexually transmitted, but unfortunately, your traditional kind of barrier methods like wearing a condom doesn't work because it's skin-to-skin contact. So it can be the area around the sexual organs where it's passed on. So it's you know, it's being careful and hygienic as much as you can, really.
Reduce the number of sexual partners that you have. So just try to do that as well, because the less the less you are in contact with other people's private bits, the less you are likely to be in contact. So yeah, barrier, is it called a dam, Sophie? You know what
Dental
it's
dam,
called.
yeah.
You can use a dental dam, yeah.
Yeah.
And reduce the number.
And well, I want to thank you, Catherine, for spending some time to talk to us about it. I know I joked, but you are a very busy person, so it's very appreciated if you can set aside some time just to talk to us about something that we're all passionate about. So that's lovely. Do you want to just say if someone wanted to try and find you or PortmanDentex, how could they do that?
So if you want to connect, look out for me on LinkedIn, Dr Catherine Tannahill, or on Instagram, and you can find our PortmanDentex website now.
Oh, and we will link all of that in the description of the podcast as well. So yeah, thank you again for joining us. It's been really lovely to speak to you. I'm hopeful we'll speak to you soon, with Smile Month coming up. But yeah, that'd be cool. And thank you from me and Karen.